if you're wanting a wholly holistic psychiatric practice without prescription of medication, and you don't know if that's even possible as a Psych NP, let's talk about it. And if you're new to my channel, hello, my name is Alysha, I'm a Psych NP, and I own a private practice, and I teach other Psych NPs how to find freedom and balance in their lives by opening their own private practices as well. Today we're going to talk about the FAQ that I get frequently, and that is, can I have a private practice where I don't prescribe medication? And people come to this desire from many different directions, and I think that all forms of private practice are completely valid and reasonable. So first, I'm going to give you a bit of advice, and then I'm going to have a three-step approach on how you can start to think about building a private practice that is entirely holistic. So the first piece of advice I'm going to give you is that when you start to think about stepping into entrepreneurship, you need to really start to reframe your thinking. And so I get a lot of questions that start with the words, can I blank? And the reality is that most things are possible with private practice as long as you stay within your scope, which we'll talk about later. But instead of saying, can I do blank? The question should be, how can I do blank? If you've already decided that you want to do something very specific within your private practice, ask yourself, how can I do it, not can I do it? So with that in mind, let's cover three main pillars that are really important when you are thinking about doing this. So the first pillar is going to be, think about your why. So why do you want to offer entirely holistic services? What brought you to this, right? And so I'm going to give the example of maybe you are, like me, a cancer survivor. So you might be a cancer survivor and you may have seen that Western medicine had its place, but also holistic remedies were really helpful too. Maybe supplements, maybe you followed a really clean diet during chemo to lessen side effects. I don't know, the number of things, right? And maybe you think I could really help and guide people into holistic mental health that are cancer patients. Let's just take that example. So that's your why. And so really your why should really anchor you so that you feel really good about your decision. And that is kind of the main overarching idea for your brand, is that, I've experienced this and I want to help other people feel better with this modality that I have that helped me. So number two is going to be your scope, right? You're going to want to stay within your scope and training. So if you don't really have any training in holistic psychiatry for oncology patients, you probably want to do some continuing education on that. You might want to go to, more lectures, do some CEUs, maybe even take like a course or a program, and just make sure that it's within your scope, right? So most of the time, the holistic side is covered within our scope. Some of you guys may see this also, a side of this being psychotherapy. So say you're wanting to add in CBT for cancer patients to help, work on their mindset around being sick. So you may want to take a CEU course if you want to clean up your CBT skills, or you may have already taken a CBT course and maybe that's why you feel like you can offer this. Psychotherapy is within our scope. Med management is within our scope. Holistic recommendations are within our scope to a limit, right? If you go kind of more fringe into functional medicine, you may want to get, additional certifications and things like that. So we talked about your why, and we talked about thinking about your scope. So why you want to do this, what you're essentially allowed to do. And then last, I want you to think about your special sauce. And so when patients are thinking of coming to us, they're going to see our website and you're really going to want to explain what you do well. So you may say, I help cancer patients manage the emotional burden that cancer brings during treatment through cognitive behavioral therapy, nutritional recommendations, and supplement recommendations. And I coordinate care and connect with your oncology team so that you feel like it's a team-based approach to help heal your mind and your body as you go through cancer treatment. Something like that. So you want to think about your special sauce so that you can clearly communicate what you do. Okay, so as a wrap up, I hope that this helped empower you if you're thinking about having a fully holistic mental health practice, or if you are thinking about doing psychotherapy only in your private practice. And so when you are thinking about these things, again, as a quick recap, think about your why. Why do you want to do this? So that's going to help you understand your special sauce. and make sure it operates within your scope of practice as a psychiatric nurse practitioner. So again, don't be afraid of doing something creative with your practice. I have now mentored over 200 Psych NPs starting private practices. I've mentored individuals opening practices that are focused more on coaching, focused more on psychotherapy, don't have any prescribing element to it, have prescribing plus psychotherapy. There are so many beautiful options that can happen with a Psych NP private practice, and I really don't want you to be limited by the things that you have seen exist, which is med management practices only, which is what we see most commonly. So I want to encourage you not to limit yourself, and if you feel like you need some help getting to where you want to get with your private practice, I have a full mentorship program where I mentor Psych NPs starting private practices and growing private practices. So go ahead and check the link down below and you can get more information. In the link below, you're going to find my masterclass where I cover early steps in opening a private practice as a Psych NP. And so from there, you can apply for my program, and I hope to see you in there. All right, I hope this video was helpful and helped open your mind to what's possible with a Psych NP practice. If this video was helpful for you, it really helps my channel if you subscribe and like the video, and I will see you guys in the next video. Take care.